If I could get our panel to start making their way up here, I'll do quick intros. See Stephanie coming up, Stephanie Boreal. Stephanie is SVP of Health Strategy and Wellness at Watermark Retirement Communities, roughly 40 communities, right? Based in Tucson, and we'll get to their value-based care programs here in a moment. Thank you, Stephanie. Chris Hyatt doing a doubleheader. He was here yesterday, and yet again, here he is again. So as we talked about yesterday, Chris is co-CEO, New Perspectives, Senior Living. Chris, you said 47 communities? There you go. And based out of Nashville. And again, we'll talk more about some of the value-based care programs they're in. And then my friend John Chaffee, founder of Alice by MedIntelligent. And John, founded the business about 20 years ago at this point, based out of Chicago, and as a EHR provider, they are right in the thick of this transformation with value-based care. So I want to thank all three of you for taking part. Let's go ahead and get some microphones. I'm going to move this. Oh, thank you. Appreciate it. Off stage and take a seat. Thank you all once again for joining. As a starting place, let's just talk about, in particular, and Chris, probably a reminder for the audience, but maybe Stephanie, talk about the value-based care programs that you guys are taking part in at Watermark.
Absolutely. So when we started down this journey in 2022 with value-based care, we started looking at Medicare Advantage plans, and then soon realized that that's not the route we wanted to go. We wanted to take a different journey. And we looked at partners for primary care, and then soon realized that in order for this framework to be successful, we needed to pull in our therapy partner, our pharmacy partner, and our EHR. So all of those individuals came together for some initial conversations where we identified what the expectations look like, where there were handoffs, identified kind of swim lanes in the process map for that. And then since then, we have pulled in our partners, LifeLoop, because the social engagement piece is such a critical component to that as well.
And are you in an actual risk-bearing relationship? Is it performance-based, shared savings?
So we are shared savings.
Okay,
yes.
Great, wonderful. And then Chris, do you want to remind, because we do definitely have some new participants in the audience today too, you want to remind folks the programs that you guys are in?
Yeah, sure. One of the things is that from a program perspective is I kind of viewed this from the lens of, for many operators who've been doing this for many years from a life engagement, a life enrichment perspective. But really, after working with LifeLoop, especially my team, that has really leaned in to the social determinants of health, is we've kind of just really taken activities much more seriously, Rob, than ever before. Being in the business as long as I have, it was always kind of like keeping people busy. Yep. Purposeful work, but we've really leaned into, how do we really practice what we preach in terms of moving from just away from activities to more meaningful engagement, person-centered approach, bringing more of a wellness, because it's been more of a healthcare focus. And to your earlier point, it's both. You can't do one without the other. So programmatically, you'll hear over the course of the next 17 minutes here or so that we have leaned into the utilization of LifeLoop. And my most important thing I want to get across, Rob, to the audience later is what they need to take away from just a few minutes that we have up here. And I want to stick the landing with that, hence why I brought some of my notes with me, because I know the folks in the audience want to figure out how they supercharge or turbocharge their actual life engagement program. And I don't want to be in a place where I want to bring data, not donuts. Yep. That's kind of where I'm at right now.
Yep. I like it. And I'm going to actually, some would think this is counterintuitive to do, but I'm going to suggest that we think about engagement not just as LifeLoop, because there are other providers out there, and I'm not necessarily advocating for our competitors, but think about engagement at large, though, because I do think that this is an opportunity within the market that a lot of providers or operators have an opportunity to lean into this a lot further. Obviously, we think very strongly about the way that we're going to do things. Chris, you're going to talk a little bit about, I think, some results we've had, but just more broadly, the opportunity in this market for engagement and what its impact has to value-based care. So, Stephanie, real quick, I guess as a follow-up question, how do you view social wellness goals against clinical and operational goals in your value-based care model?
So let me back up, because we talked about value-based care strategy and kind of entering the market. But prior to that, in 2020, what we decided to do was we focused on our 360 Well program. And so value-based care is a part of the overall culture of well-being. And so that's where this isn't, and I agree with Chris, because I think that prior to that, it was really like social engagement was kind of off to the side. And so that is a critical piece to the overall well-being kind of plan that we have and we're rolling out. And so just as important as the clinical dashboards are to our clinical teams and looking at falls and return to acute and polypharmacy, we're also looking at engagement and well-being scores.
Do you want to talk about how you're actually using different metrics relative to those scores?
We definitely can. So when we established our 360 Well program, we put a 360 Well index in place. So this is subjective, and it allows our residents, this goes back to Joelle's comment on resident-centered care and putting them in the driver's seat, because the other piece to this is, and Alan said this yesterday, and I thought this was very important, but what we do for our residents, we take away from them. And so how are we putting them in the driver's seat? That's what the 360 Well program is really intentioned to do. And we want to know from them, based on where they fit with mind, body, community, or spirit and community, where they fall on that wellness index. That gets blended in with those clinical outcomes. It also gets blended in with some of the other stuff that we're looking at. I think there's several conversations happening right now around additional technology for remote patient monitoring. There's all these pieces of technology that get kind of pulled in for predictive analytics. But what we're trying to ultimately do is create an environment where people feel like their well-being is important and they're succeeding in that. And that's ultimately what drives length of stay. I mean, you showed it on your data.
Yep. Well, thank you. Hey, that was a great transition, because one of the things that we were talking about at our table over here was you just mentioned many of the value-based care outcomes measures that people talk about, whether it's hospitalizations, ER visits, things of that nature, and making sure that we're doing what we can to reduce those appropriately. But there are other metrics that are supportive to operators holistically and more traditional metrics. So I'm going to tee you up, Chris, maybe to talk a little bit about how you guys, what metrics you've used to support some of your value-based care initiatives that aren't necessarily outcomes value-based care driven, but instead operator driven.
Yeah, I want to piggyback on Stephanie, and then I'll answer that, I promise you. I'm going to put myself back in that chair where you're sitting at right now, and some of you are taking mental notes, physical notes. There's some key takeaways here that I think, and I'm happy to circulate my notes, Rob, for people just to take back and think with them. I'll offer them up to anyone, but I brought them up here so we don't get off track. I want everybody to just think through this. Social wellness could be thought of as strength, a frequency, and the quality of residents' meaningful connections. And so all that's with a goal to reduce isolation and loneliness. But there's three things. And you know you're going to get put into a breakout in a minute, so I'm trying to help you all out. All right? So there's the way we think about it at New Perspective. You can plagiarize this, create something off of it, but we look at it three-prong approach. Connection quality, which means belonging, purpose, and meaning. Secondly, we look at it from a network breadth. So family, friends, and team members. And then third, participation. And what we add to that is variety, intensity, and regularity. So as you're thinking through your definition and in the context of value-based care, that's how we think about it. To Rob's earlier point, whether it's different or different platform or different approach, I wanted to give you something to jump off of. And then we use things, Rob, like a comprehensive nursing assessment that we use questions from UCLA on a loneliness scale, and also the pain assessment and advanced dementia scale. So I wanted to just lay that up there with our little bit of time that we have here. And then I want to just kind of roll into Rob's last question here, which is, have we seen social wellness initiatives impact the resident health and the outcomes? Of course. How are you measuring the success of ROI? So, Rob, if you're okay, I don't mind.
Yeah.
You okay with me talking about the study?
Yeah.
Okay, because really this is you guys.
Yeah.
I'd say it's we.
Yep.
But you guys were the drivers of this. So this was really an eye-open moment for New Perspective, and some of the folks that were behind this are not here today. So extraordinary people that worked in the organization, like Brandon Tabbert's one of them, Kirsten and Allie and others, worked with LifeLoop. And we did a 15-month study that found an incredible 172-day increase in the median length of stay. And I'm going to preface this, and this is why I brought notes, right? I got to use facts here. We have a PhD researcher that worked with us on here. So don't take my words out of context. But it's a 172-day increase in median length of stay for high usage, highly engaged communities. So high usage for New Perspective meant the technology was deeply embedded in our operations. So think program design, attendance capture, personalization, family connection. And we believe that this is the first quantified ROI for engagement technology at a portfolio scale. Yep. And so I know the paper was put out, Rob, by LifeLoop, but our team was so passionate about this that we worked months and months and months and months and months to get to an extraordinary level of ROI. Again, that is like optimal life engagement programs. And so I wanted to, if you haven't read the paper, I certainly wanted to stick the landing on that today because it's been a pretty extraordinary evolution at New Perspective.
Yeah, thank you. And we're going to have a QR code, of course, so that everyone has access and can download that. We'll show that here shortly. John, I want to talk to you a moment. Alice has created a phenomenal marketplace of apps and partnerships, and we're fortunate to have that relationship with you as well. What are you seeing as it relates to your customer base, whether it's value-based care or specifically in the realm of engagement and partner connections there? What are you seeing there?
Definitely. Thanks for having me on first. Second, when I hear Stephanie and Chris talk, super impressive that you guys have pulled all the pieces together. I'm coming at it from a technology background and a technology focus, and I'm like, how do all these pieces connect, right? Because today, what everyone is faced with is desperate pieces of information that they have to make sense of, and value-based care is synonymous with data. Everyone talks about data, how we need more of it, how we don't have the right metrics, and it's really hard. It really is a big challenge for operators to pull the pieces together, and the challenges are a multi-layered cake, right? First, you have a challenge of usage. People are not necessarily using these systems, so there's not a lot of data to work with. Second, traditionally, healthcare has been sort of against connecting information, right? Everyone puts up moats and barriers, and they trade on data, right? I use the term of don't be a data troll, right? To ask for a token to pass data between two systems. You all pay your staff to put information in these systems. These data points need to come together. I had the pleasure yesterday of talking with George from Safely You, and we've got great partners here with CarePredict, and Rob and I had an extended session at Nick about how do we put all these pieces together. Your EHR is your best central database to connect all these pieces because it actually has the authoritative record on the resident. And really the goal for value-based care, in my opinion, is to actually create a more complete digital picture of the resident. The chart that you put up, and I'll give up the mic in just a second, showed that the healthcare component, which is traditionally what we think of the EHR as for, right? The H in EHR is only 20% of it. That's not the complete picture.
Yep.
And when you're thinking about value-based care, you want leading indicators, not lagging indicators. People put information in the EHR after something has happened. Yeah. Now, there are some leading indicators that go in. For example, changes in medications is a great leading indicator, right? Nurse call information, right? Coming from our partners like CarePredict, Safely You, and others, leading indicators. But majority of everything else, notes that are put in by staff, they're documenting something that's already happened, right? So the vision really is open borders, let data connect, pull all the pieces together, and then start to center around 5 to 10 key KPIs that the buildings can actually measure, rally around, connect to, and really move the dial on.
And to your point about those KPIs, you're not just talking about clinical KPIs. It's, there are other factors, again, wellness factors or engagement factors that folks like ourselves can help support within your model as well.
100%. Let's use your number of 20%.
Yep.
Right? The EHR has 20%. What's happening with the resident 80% of the other time?
Yep. Yep.
We don't really know.
Yeah.
And a lot of that is actually tied into that social engagement and activities and the experiences that the other touch points that they have beyond care aids in the community.
Yeah. Thank you. I want to shift gears a little bit, and I know we don't have a lot of time. But Stephanie, I'm gonna start with you on this because I think this is an intriguing question because we talk about this in a very broad basis, but we also know within senior living we have different profiles, whether it be independent living, assisted, or memory care. So how do you ensure that social wellness strategies are inclusive of residents living with dementia or those who are nonverbal or less mobile?
So I think that this ties into our Prima memory care program and the number of signature programs that we have. And so this goes back to the 360 Well approach because 360 Well is really personalized well-being. And so these signature programs identify personalized playlists. This is something that we do through our resident engagement software. It also identifies what we call Ananda baskets, which are activity baskets. There's a pantry program that we have. So very personalized approaches to the individuals who are in our memory care program. And we find that information out through likes and preferences when we're doing the interviews with the individuals and their families. And so the other piece that I will plug in here is more recently, we've started to adopt some new technology. And so rather than going through the typical pen to paper approach, now we're recording those and we're collecting a lot more data points. So instead of 50 data points, it's more like 300 data points that we're able to pull in and create a bio that's very specific to our residents for. And so that's helpful in kind of aligning with those personalized approaches. That's just on the engagement side.
Yeah.
Yes.
Nice. Chris, anything to add that you guys would be doing differently?
No. I'm watching the clock.
Yeah, I know. So for other operators looking to strengthen their approach to social wellness, where would you suggest they start, and what lessons have you learned along the way? Maybe if there are quick lessons, great because of the time. But
Yeah.
where would you, starting with you, Chris, where would you tell them to start?
Yeah, this is where I wanted to go. Thanks.
Yeah, sure, absolutely.
With 2 minutes left. All right, here we go. Again, you guys are going to be in groups again. So this is why I'm up here a second time. First time I learned some lessons. Bring a few sticking points because there's a lot of white noise up here. So I want to make sure that this sticks. 3 pieces of advice. Again, is my opinion. Take it for what it's worth. So adopt a standard assessment or screening tool and discuss the regular results across clinical and operations and life engagement. That's number 1. Number 2, formalize the calendar. If it's not measured, we say it's a hang session. It's not a program. So use attendance and engagement data to inform the calendar by retiring low-value events and replacing them with high-value ones. And 3, we say create an at-risk cadence. Ours was called, and still is, the golden opportunities. Again, you coin it whatever you want. Anyone with rising isolation risk, 0 attendance weeks, or recent loss could get a specific connection plan for a period of time. So you're focusing on named invitations, one-on-one activities, family prompts and sessions, and purpose-based activities for at-risk residents can teach the entire team how to help residents find purpose by focusing on a single resident's ability and or inability to do something. And so those.
Woo! Bringing it home.
That was good, man.
That scared me.
If everybody does go back and start talking to their teams about sessions, I think we've missed the point.
Yeah. Great. Stuck, man. Your message stuck. Very good. Chris, thank you.
Second time helps.
All right. Well, with that, going back to Chris, all those things you just mentioned again, and it's a wonderful partnership that we have, but it has afforded us to prove out this length of stay, which is great for operators. But I'm going to tell you, those that hold or bear the risk of those residents from a healthcare standpoint, it's even better for them as well. So kudos to you guys. I want to. We're up on time. I guess let me give it to the hecklers over here. Oh, here we go.
We're gonna head into a breakout, but I want to. The thing about this panel, right? You saw this value-based scratched out and valuable. That's what this panel really epitomizes, right? You got a nickel of value-based care money because of this, Chris? No, but you're winning, right? Because you've got increased length of stay. Your residents are happier, they're healthier, and that's what this is about. This is an extreme, guys, look, I know we're getting close. This is a very important topic. Let's have some really good discussion about this. I mean, we talked about this yesterday. As operators, we don't do a very good job at this at all, right? Let's learn from what Chris and Stephanie are doing. So let's have a really good, robust conversation at our tables. Again, we got questions teed up. We've got 20 minutes. We're going to roam, but I mean, this last 15 minutes of this was extraordinary, right? And we need to build upon that. And let's talk about this because it's a problem in our buildings, a significant problem. Let's have 20 minutes, robust discussion. We'll bring it home and integrate it when we're done. We had a great end there. And my question, I guess, is for Chris as we start the integration. I want to know, as an operator, how did you get just adoption and utilization? I mean, I can't tell you how many platforms we rolled out, right? And they sit there and nobody uses them. Yep. How did you get utilization and get your individual communities to buy into what you were doing?
We told them to do it.
Yeah, Top and that
down.
Works, right?
It's all about top down.
I told these guys things too, and you see how well that's working.
Next. I forgot table number back here. 13. Lucky 13. and 24, I think very far left for me over here, had the same questions in just 60 seconds so that I can share this time with our colleagues in the industry up here. You can have the best platform in the industry, the best system, right? And Rob said there's many of them out there. There's multiple ones. We talked about one I did today specifically. But it is the people. Alan, I don't want to simplify it, overly simple, it's not a complex thing. We had to find somebody who was extremely passionate. Somebody was a subject matter expert in this, and or if they weren't, they were on a learning journey like you've never seen. And I know Paige, she's nodding her head. She knows the resources that we put towards it. And what we did, we said this to Table 24. If you can't afford at this moment in time a subject matter expert with the passion and the perseverance and the grit to push through, and by the way, a sustainability plan, to your point, Alan, because the next new thing's right around the corner. 6 months later, we roll something new out. Who's charged with keeping that level of sustainability? And so we married up Resource Center, we call it AKA corporate office resource, with a community resource who is an executive director. And I didn't get a chance earlier to say this, but I told this to Table 24. It's a really incredible story. We were given a community by Welltower that was 44% occupied. It was the lowest occupied community out of 1,200 Welltower properties across the United States. And they gave it to us.
Did you tell them thanks?
And talk about pressure, man. Fast forward a year later, Paige, Rob, others will know this. Kirsten, the ED that we hired a life engagement director to run the building because one of the things I noticed when we walked in, it was lifeless. Now, part of that's because there was only like 40 residents in a 100-unit building, and everybody was probably sleeping. But and somebody goes, they don't have experience. I'm like, exactly. I don't want them to bring that level of experience. I want them to bring a level of engagement. And this individual worked with Brandon, and they were extremely passionate. And then they, together with Allie, a nurse, went across the entire New Perspective chassis, all communities, the right training, the right onboarding. There was a lot of discipline involved to getting to that level. And now it's like, whew. And we're like, oh, you can't do that. Somebody's got to keep this thing going. So that's kind of, and by the way, the community in that 15-month period of time went from 44% to 82% occupancy. Yeah. And we're now off of the naughty list at Welltower.
All right. And it's a champion, right? Somebody has to champion the cause and keep it rolling. Stephanie, similar.
I would say the conversations at the tables were all a little bit different. They were fabulous, but the one thing that I think is a key takeaway for this conversation is you've got to put social engagement in your line of sight, and it needs to be just as important as some of these other initiatives because it is a leading indicator, not a lagging indicator. So I think Dr. Puri said, he used the analogy yesterday that value-based care, like with the health systems, was pulling bodies out of the river, and we wanted to move upstream. The way you're going to be able to move upstream is not only to do the collaboration and coordination with your care partners, but you've got to get your social engagement in there, and that puts you even further upstream.
Yeah, absolutely. Absolutely. What else? How's my...
Yeah, we had we have a hand up? Okay. Let me come over to you with roaming mic.
There was an interesting insight that came out of our conversation, and it was, could we get a self-reported wellness score from the patient, from the family, and from the clinician? Could we do it before they move in, and then could we do it afterwards? And then to see where do these three wellness scores balance from different perspectives. And that was just a very intriguing insight to say, how would that move the needle? What would the barometer look like if we were actually hearing from those different perspectives? So it was intriguing.
I want to go to table one over
We
here.
actually do that.
Oh, sorry, go ahead.
Yeah, I was just going to say we do before people before our residents move in. We do not do the family. That's an excellent idea.
Yeah, it is. And just relative to wellness scoring as a whole, that's a journey that we're on right now as well, regarding social engagement index that we're creating that based off the data that we have access to. And we get caught up at times in conversation because quickly a lot of us go to perfect versus good, and perfect is the enemy of good. And so part of this is just as you are here, taking one step at a time to progress and refining and getting better time over time. So just a piece of advice. Do you have?
No, I was just going to add and do a shout out for table 14 because they, as part of taking those steps, they had a couple of really clever ways to think about engagement. I think Donna, did I say 14, 12? Thank you, Donna. I appreciate it. I was at 14 and 12. I mixed them in my brain. I appreciate it. But what Donna mentioned is that in her community, and would you want to actually share the story yourself? Yeah, let me bring the mic to you. I'm coming right down because I don't want to butcher it. That was good.
Good afternoon, everyone. We were talking about kind of the culture in the communities that I lead. And I work for Salinity, which is based in Knoxville. I'm here in Atlanta. And one of the things that is very, very important to us is we don't call our rooms apartments or units. We call them bedrooms. Because what do you do in your bedroom? You rest and you sleep. You don't eat in there. You don't socialize in there. You do that in the home, which is our community. The other thing that we talked about is facilities, an F word for us. We don't say facility, we say community or home. Thank you.
Yeah, I learned the no on the F word in my rookie season.
I think we've got one more over here. I think there were a couple tables you all included, table one, talking about staff and impact. Is that right?
We did. We talked about, we have all this data, but in order for our residents to be truly well and engaged, it starts with the caregivers. And so in order for caregivers to feel connected and to have purpose and meaning in their work, they have to know, like, what is that? We talk about this at Bickford, like, what does that look like as a caregiver? How do I know that I'm winning? How do I know that I'm contributing and making a difference? Because ultimately, that's why most of them have chosen this line of work. And so we're just trying to be very creative and intentional with ways through the like the utilization of working with Evan and Card with our Montessori program, and then just being able to highlight and share those success stories, as well as sharing with our caregivers all of this outcome data that we are receiving on a weekly and analyzing, you know, reduction in falls, reduction in hospitalizations, and making sure that they understand their piece that they played in contributing to those outcomes. And as a result of that, we survey and measure the satisfaction of our employees on a monthly basis. And since we have rolled out Montessori in those branches, we are seeing month after month climb in those happiness and satisfaction scores with our employees.
All right.
Yeah, it's a solid point because social wellness extends beyond the resident and the family journey. And
exactly right.
I mean, that was a great testimonial from Shannon. If you watched the video yesterday and you were like me, I was as much admiring the interaction that the staff had amongst themselves, the volunteers had amongst themselves in that Project Love Meter video. It's very powerful.
Yeah.
Just wanted to build on the question that came up here, or the discussion at table 8. We were having a similar discussion between how do you look at the resident, not just from the clinical assessment, but Stephanie, you mentioned you guys are doing something along that. I'm curious if is it something you're doing with your CRM, where you're looking at or partnering with the sales team and bringing that information forward for a better transition?
The answer is yes. So we use our CRM to generate a whole host of questions on likes and preferences. And then we establish that at the time of move-in, and then we do 6-month follow-ups. And in addition to the wellness index that goes out and asks questions in regards to that, we're also asking questions about just general satisfaction but very specific to dining, to healthcare, to the amenities. And so those pulse surveys all get pulled together and shared with each community as well as across the board. And we're also having conversations to see how we can integrate that CRM data into our resident engagement system too.
How do you, we talked a little bit about this at our table too. How do you get engagement across not just the life, enrichment coordinators and those individuals? How do you, as an operator, get everyone to buy into this aspect of social wellness, right? And not make it just, well, that's activities, right? That's what they do. I'll do the clinical component. How do you get buy-in at all levels in the individual communities?
You don't. The reality is you don't. Do you want me to say you do? The reality is you don't. There are just some that are not as passionate about it. So we do take the training all the way down to the caregiver level and say it's not one person's job, it's everyone's job. But what you find, and it varies by communities, you know this, Alan, you might have 10 real ambassadors, disciples, if you will, of a program. In another building, you might have 3. Another one, you might have 6. And what you hope for, and I know hope's not a strategy, but that more people around them see the extraordinary impact that they're making on those seniors' lives. But the reality is, if you got 50 to 80 employees in a building, maybe your experience is different than mine, Stephanie. I mean, you're going to have half a dozen or a dozen that really, really get it.
Yeah. But Chris, it's fair to say that you don't, from your level at the very top, you recognize that's the reality, but you're still shooting for ideal every day.
And that's my sustainability plan. Yep. We just don't give up. Yep. We just keep persevering, pushing through. Yep. And we are systematizing a lot of things, and someone else, I think it was table 24 also, that brought up that, well, what happens when somebody leaves? Well, that's back to that sustainability plan. Who's the champion at the company, or they're the ambassador that picks up where somebody left off? Yep. And that's with any platform or program that we have.
Hey, Alan.
So can I?
Oh, sorry. Go ahead, Stephanie.
I was just going to add to that. So to be very real, I think that there's definitely some buy-in that could be done. However, I think one of the things that we've done that has been helpful to this conversation is my responsibility is over clinical operations, resident engagement, and culinary, as well as well-beings. So with that, there's all of these connection points. And so how sticky can you make it? And so we have our 360 Well coordinator who's really focused on movement and fitness. They're a pass-through from our national partner for therapy. They report up to community life, but they've got a dotted line to clinical. And so that's just one example, but there's a few of them that exist. And so how do you connect the dots and then get those conversations going? Like, our clinical team is incredibly interested in getting the social prescription inside the assessments. So it's creating those connections.
Right. Joelle?
Sorry, I want to bring it back home for us, and I'm going to come over to someone who was a 5 on the value-based care expert rating. And I'd like to hear from you on, from your healthcare, value-based care expert point of view, how does this conversation drive value in VBC?
Sure. So, two quick points. So the SDOH at the high level, so that's where we started, just as you remember the standard drivers. That's actually used as a screening in every emergency room that is an acute care hospital in the country that CMS pays. So this is fundamentally driving the systems, all systems. It's everywhere, number one. Number two, the aspects that we talked about at our table, like everybody was really curious. We all wanted to open that. We all want to open up the study. We want to know what was in there and how it happened. And the stories that we heard and the insights that you guys provided, I think set the stage for the social index. We really went pretty deep into the food quality and what that meant for social well-being. And that's where we ended up. And that's also part of that SDOH measure. And that drives the holistic piece, which I think the 360, I was curious about that to learn what those features are, because it stacks, it's scaffolding, it builds, and the results do mean something. They mean something to the resident. They mean something to the community. They mean something to the payers. They mean something to the providers that work with them. Did that answer you?
Yeah. So thanks, Tim. I didn't mean to put you on the spot, but I wanted to make sure everyone understands that there's real dollars and real value from a healthcare system perspective around social determinants of health and resident engagement and satisfaction and their perception of their quality of life and health. And so that we do these things because they're the right things to do, and we know it makes the experience better for our team members and for our residents, but there is real value from a healthcare, from a valuable and value-based care perspective here as well. And this is where this industry has an awesome opportunity to play a huge role in demonstrating and showing that value, because usually at this stage of life, we're not really following a lot of curative treatment. It's about, can we make this the best chapter for you where you are? And that's the value that senior living is delivering to the healthcare system, because no payer and no provider in the room, and I know all of you are going to, maybe disagree with me, are going to be able to provide that to them. That's this industry's role.
So, look, guys, here's the thing. I would absolutely encourage you to continue this conversation and seek out Chris and Stephanie, right? Obviously, they are extremely passionate about this. They've implemented this. Seek them out and talk about this. This is an important topic. It's something that we, again, need to do a better job of. Talk to Rob. Talk about this openly, and they're not gonna hold back. They're gonna tell you what worked, what didn't work. But seek them out and keep this conversation going, because it's very, very important. Thank you all. I appreciate it very, very much,
for your
guys.
expertise.
Thank you.
Yes, thank you.